Hey, it's Jessica DeMassa with WTF Health. What's the future health? I'm talking to the who's who of health tech and healthcare innovation. And today we are meeting the folks at LexisNexis Risk Solutions. And we're going to be talking to them about all the cool things that they're doing with massive amounts of data to help improve social determinants of health and health equity. So here to tell us all about what is going on is Jeff Diamond. He is the president and general manager of the LexisNexis Risk Solutions healthcare business. And we have Andrea Green. She is the former CNIO at Trinity Health of New England. And at LexisNexis now, she is leading the development of that social determinants of health product suite. So thanks you guys for joining me. It's a pleasure to meet you.
Thank you. Pleasure to
Thanks
be
for
here.
having us.
So excited to jump into this because especially right now, health equity is so important. That SDoH data, even more important because that's how we get there. But before we start off, like Jeff, I want to hear from you. Tell us a little bit about what LexisNexis Risk Solutions does, because I'm not entirely sure everybody equates LexisNexis with healthcare. But you guys have a thriving healthcare business. Tell us all about what you do.
Yeah, I appreciate that. So LexisNexis Risk Solutions operates in a wide variety of verticals, and I have the pleasure of leading the healthcare business. In healthcare, we see ourselves as the premier destination for data and insights. And our business more or less is grounded in one single operating tenet, and that's to enable healthcare data and insights for good. We use a big data processing platform along with advanced linking and machine modeling capabilities to really provide industry-specific, customer-centric solutions that help our customers operate better or create greater efficiencies for their patients and their members. And across the healthcare ecosystem, we really operate across and service 5 various constituents of the healthcare ecosystem. We work with retail pharmacies, whereby 10 of the top 10 retail pharmacies are customers of ours. We work with life science and pharmaceutical manufacturers. We have 8 of the top 10 pharmacy manufacturers as customers of ours. We work with hundreds of healthcare IT and healthcare IT and hospital systems across the United States. And about 90% of commercial payers are customers of ours. At the root of it all, we're really one of the few data assets behind the scenes helping the healthcare ecosystem operate more efficiently and to create healthier communities.
Wow, I mean, that is an impressive client base right there. It's like the biggest of the big. I mean, obviously a lot of data powering all of that. Can you kind of bring this to life for us? I'm very curious about specifically like within, and that is like literally everybody in the ecosystem, more or less. You've got everything from those retail pharmacists to the health systems, the payers, everybody. But, can you kind of talk through maybe some specific examples of what you guys are doing to help them improve their business, improve health outcomes with the data that you have?
Yeah, so LexisNexis has data across 3 disparate data classes. The first is consumer data, which is synonymous with patients and members. We have a really deep and complete provider data asset, as well as a medical claims asset. And with those 3 data assets, we've really been able to focus on 2 macro level use cases for our customers. The first is improving health outcomes, and the other is to improve operational efficiencies. So I can give you a couple examples. In the provider market, we work with hospital institutions across the US who are looking at physician splitting behavior and trying to understand where it's happening and why it's happening so that they can make operational changes to kind of capture that revenue back in the system. Our claims-based solution, MarketView, actually is purpose-built for that solution, for that use case. We also work with about 80 different payers across the United States to ensure that their provider directories are being kept up to date. This not only helps them stay compliant with state and federal regulation, but ensures that their member base is getting the best possible consumer experience that they can. On the outcomes-based use cases, we work across a variety of different industries, as I mentioned, but I can give you a couple examples of where we deploy outcomes-based solutions. Within healthcare IT, we support dozens of organizations that do care management, population health, risk stratification, ingest our social determinants of health data solution based off of that consumer data I mentioned earlier. And they ingest those insights right into their platforms and combine it with their customers' data to really derive greater analytical insights for their customer base. This all leads to greater patient level insights and patient level outcomes for their customers. The last use case that I can provide for you is patient safety. So with our consumer data that we have, LexisNexis being a leader in data linking, has been able to utilize that data asset to really ensure patient safety by linking disparate health records together. Ensuring that records aren't overlinked or underlinked is an absolute patient safety concern and something that we help constituents across the ecosystem with on a daily basis.
That's phenomenal. Overlinking or underlinking patient record. I didn't even realize how big of an issue that is, but I would imagine that is a significant impact on a patient's safety if they don't have, if a physician
It
does not
is.
have all the information, or if there's duplicate information. That's incredible. All right, Andrea, I want to bring you into the conversation here because one of the data sets that Jeff mentioned was the SDoH data. So tell me a little bit about that. You're obviously, like we said at the beginning, you're leading the development of that product suite. And I'm curious to know, like, what are you guys considering social determinants of health data? Like, what is that? What kind of data is included in that? I mean, everybody always talks about how your zip code is a factor, right? But I mean, beyond, what else is in that data set? And then how are you guys using that right now with this new suite that you're developing to help your clients make inroads into like some of these greater concerns about improving health equity?
Yeah, so that's a really good question. I think what I want to do is share a little bit of my background and kind of what led me to the role that I'm in now. So as a nurse, moving away from patient care wasn't really a very easy decision for me. So moving away from the bedside, and I wanted to make a bigger impact on the way that we care for people. And I think that using data is one of the ways that we can really do that, right? We're revolutionizing how we care for the whole person. And that to me is incredibly fulfilling. And I'm really proud to be leading our efforts that help address health equity. LexisNexis Risk Solutions has a consumer data set of over 1,000 socioeconomic attributes, and we're able to analyze them and select the most meaningful attributes that are correlated with health outcomes. So what that means is our statistical modelers and our data science teams have curated the attributes to only include those that have predictive power as they relate to health outcomes. So more data isn't always better, right? And this is really what makes us different from a lot of the other data vendors. That those data vendors might only provide consumer data or marketing data or publicly available kind of census data. And, we're able to provide a very comprehensive picture of individuals, both economically speaking, right? But also in terms of housing stability, education background, insights on neighborhoods, and even their support systems. There's an incredible amount of data out there, and healthcare organizations are just starting to put the pieces together. And having SDoH related data on patients and members can really help identify patients at risk, earlier. So then they can address disparities in access to care or even quality of care at an earlier state. So we can look at hotspots for diseases and SDoH data to turn every study into a health equity study, or enable organizations to examine their communities and maybe address underlying factors to health that can help create those healthier communities, right? And when I say turning every study into a health equity study, what I mean is every study needs to take social barriers into consideration and structural determinants of health, right? Our life sciences companies, for example, are starting to really incorporate SDoH factors into clinical trial planning, right? So the FDA guidance came out on enhanced clinical trial diversity back in 2020, and it's really essential for them to not only look at the prevalence of disease and medical treatment, but also the effects of social determinants of health and how they might affect those diseases, and also treatment or recovery, right? And along those lines, we can look at the effect that diseases might have on social determinants of health, because it can be completely cyclical, right? Is our health care system and the burdens of our diseases contributing to our social determinants of health, right? Is that a contributing factor, economically speaking? We recently worked with the National Institute of Health and the National Cancer Institute to provide some insights on participants from state cancer registries for epidemiologic research. And we were able to provide SDoH data to assess household migration and financial toxicity as social impacts that might result from disease burdens. So I think a prime future state example is linking together claims and SDoH data to find out more information around how SDoH stress can affect health outcomes beyond things like diabetes and cancer, but maybe even mental health as well.
That would be magic, like pure magic on that. That is incredible. Oh my gosh, I love that. I love because people always talk about how, your financial well-being and your physical well-being are often tied hand in hand, and that does, trickle down in a number of different ways, whether it be physical or it be something that is mental or emotional, that just dealing with the stress of that. So that is incredible. What an amazing initiative. All right, Jeff, I want to come back to you here because the thing that, the magic here, some of the magic, it can be attributed to this LexisNexis Gravitas thing that I watched the demo for. I got to see it. I don't know what to call it. Like, is it a product? It's like wizardry. Like, I'm not quite sure even what to say. But for those who have not seen this, I mean, it's pretty incredible. And the whole idea is this concept of unlocking data silos and helping, pull all of that data together. So I'm wondering if you can just talk a little bit about the LexisNexis Gravitas solution, let's call it.
Yeah, happy to.
And the key component to it that, like, it took me a second to understand, but next generation tokenization, like that is like a core concept to this. So if you can explain that, and then also talk a little bit about how that goes into Gravitas, like I'd love to hear more.
Yeah, I'd love to tell you more. So our company has historically been known as a leader in identifiable data and analytics. What we've starting to see more and more often in the healthcare industry is a dependency and a reliance and a demand for de-identified healthcare data. So to that end, what we've been able to do is take all of our rich intelligence, all of the rich learnings that we've had in working with identifiable data, and apply it to a de-identified data ecosystem. This capability that I'm going to mention here in a moment is truly revolutionary. It is patent pending as well. We are the first organization to really unlock the capability of de-identified data by ensuring that the match rate between two disparate data sets is actionable and accurate. And I'll explain a little bit more on how that works. So before Gravitas, tokenization vendors that provided de-identified data assets traditionally could only link data if they had virtually the same input criteria. So Jeff Diamond 123 Main Street could match with Jeff Diamond at 123 Main Street. But Jeff Diamond at 123 Main Street with Jeffrey Diamond at 456 Oak Street previously couldn't be linked. With Gravitas, what we use is the referential data layer, the consumer data layer that LexisNexis has, to create a persistent match criteria across those two otherwise disparate data records. What that does is it gives a longitudinal view of Jeff Diamond. So we can actually see what otherwise would be two disparate records, as we mentioned earlier, underlinked records, linked together appropriately to provide a full end-to-end view of a persona. And that, in essence, really revolutionizes the way that de-identified data can be used. You now have a more complete picture, which moves the use cases of de-identified data in healthcare from more sales and commercial orientation to really clinical context and clinically validated kind of use cases. So we've got organizations across the ecosystem interested in utilizing LexisNexis data powered by Gravitas and or the data assets of our data vendors, our Gravitas ecosystem of data vendors, to really empower new use cases that are clinically relevant. So we've got scientists and researchers and life science organizations utilizing Gravitas data, powered data assets for covariate use cases, patient safety, drug efficacy studies, and down the line. And previously, these were really hard use cases to enable with de-identified data because the precision and match quality was just simply not there, not strong enough or referenceable enough to rely on previously. So that is really the power of Gravitas. It's taken de-identified data assets and added a layer of precision to it so that the linkages between two otherwise disparate data assets coming from two different sources can be matched with very high precision and very high accuracy.
Okay, so then Andrea, connect the dots all the way through for us. So what does this look like in practice? And then how is it impacting patients?
Sure. So like Jeff mentioned, life sciences companies will be able to leverage this tokenized data for areas like research studies, FDA filings. Payers can use it for value-based contracting. There's immense value when it comes to de-identified data because it removes that potential for stigma and bias, and it removes the possible disclosure of sensitive information, especially with SDoH. So healthcare technology companies and organizations with their own data sources can now tokenize their data with increased precision, enabling business opportunities as well as, making data more readily available for clinical research, so they can work towards better health outcomes and improving health equity as a whole. There stands to be tremendous potential with this broad, diverse set of healthcare data that was previously unavailable.
I'd say a little bit more, actually, if you don't mind, and specifically on the SDoH data, because this health equity issue, I feel like this is like the issue of our time right now in healthcare. I mean, but prior to this, I think we've been concerned with other things, but right now I feel like this is just something that increasingly, more healthcare organizations all across the ecosystem are trying to figure out how to do this, and it's like data is like the core of the strategy. So, say a little bit more, Andrea, if you can, and connect that this whole SDoH data, specifically if it's tokenized, like how does that really help improve health equity?
Sure. Yeah, SDoH is really a hot topic, right? It was really brought to light during the COVID pandemic, especially with social isolation. And, we know as an industry, right, that SDoH determines up to 80% of your healthcare outcomes, and only about 20% is determined by your medical care. We know that. That's huge. And so it really drives home the importance of focusing on efforts like housing instability and addressing other issues outside of clinical care. So there's an imbalance in resources, and we, and the way that the resources are aligned. And tokenized data can help us identify where those imbalances are, and even give us insights into how we can rectify those inequities. So, previously working as a CNIO for a large hospital system, we had to look at emergency department utilization, for example, right? What kind of interventions or programs did we need to put into place? And we had to examine what were the persistent trends we were seeing with our high utilizers, and what kind of programs we might need to better serve those patients. And our clinical staff oftentimes really struggled with getting information on housing stability because of a multitude of factors, right? Including fear, maybe shame, or even misinterpretation on what housing stability meant. So the ability to provide this type of information on every patient in your population is ensuring that you're then comparing apples to apples, right? So LexisNexis Risk Solutions linking technology allows for connections between data sets like clinical data and socioeconomic data, while also ensuring privacy. Data sharing and data linking now becomes possible without that stigma or bias, or without that hesitancy to disclose that personal SDoH information. I think a great example of linking real world data with clinical data is some of the work that we did with the state of Montana's Department of Public Health. So they were looking for a way to improve their predictive models as part of their Housing is Healthcare population health initiatives. And we had developed, they had developed a housing insecurity predictive model to help identify risk for homelessness, and to help triage efforts around housing and care coordination resources within the community. And they combined our SDoH data with their state data sources to gain better insight into social drivers and understand those underserved populations better. And so by combining our SDoH data with their state data, they were actually able to enrich their predictive models by about 6.5%. So they saw that improvement in predictability compared to using only their own state data sets. So this allowed them to triage their efforts better and more accurately around housing and care coordination within the community, right? Nobody has unlimited resources, so it's really important to know where you can get that biggest impact. The Gravitas token, of course, would allow for the linking of data sets in a de-identified manner for similar efforts, and organizations that want to be able to do this type of work, but maybe are restricted from sharing personal identifiable information with each other.
Well, that 6.5% increase in that use case is a good impetus to take a look at this.
Yeah,
Jeff, right? I mean, that's remarkable. Jeff, I want to wrap this up with you because and this is the big question. I mean, I'm going to tell you what I think, but I want to hear from you. There's a lot of organizations that have access to a lot of data, a wealth of data across, different types of data types, like healthcare data, consumer data. I mean, the fact that you guys are able to link this in this way with such accuracy seems like that would be a big competitive differentiator. But, I want to hear it from you, Jeff. I mean, what makes LexisNexis Risk Solutions so stand out in healthcare versus all these other companies that have the ability to provide just a massive amount of data?
Yeah, well, I appreciate you asking. And Andrew's example of our work with the state of Montana is just one of many examples on how we collaborate with our customers for good intentions, right? Data for good, insights for good, as I mentioned earlier. There are a lot of data aggregators out in the industry today that can claim they have a lot of data or that they can provide great insights and so on and so forth. But it's really how you put that data to use, right? It's really the context you add or derive from that data that makes an organization like LexisNexis stand out. And that's really what we pride ourselves on, right? So we are constantly innovating new solutions, new insights, new technologies to really help our customers with the challenges that healthcare is facing today and pulling context out of the data to help solve for those challenges, right? And that's just something that we do on a daily basis. It's something that I pride myself on, the team on, and we're really proud about the idea that we are constantly keeping pace with the rate of innovation and the rate of evolution in the healthcare ecosystem. At the end of the day, LexisNexis is an organization that not only provides best-in-class data, best-in-class insights, but best-in-class support and expertise, and is able to really, again, contextualize information and bring out the insights from that raw data. So if you have the opportunity, that's why you should choose LexisNexis.
Okay. I love that. I mean, your data is only good as what you can do with it and what you can learn from it, right? And I am hot on this space right now of the blending of consumer data and patient data, because Jeff, as you said earlier, they are one and the same. And I think the more that healthcare organizations start looking at that data like that, we are going to get some really deep insights. And I think, Andrea, the examples you gave us with some of the work that has been done using that SDoH data, which does kind of cover all of that, is really compelling and really powerful. So thank you guys so much for dropping by and talking to us about what you guys are working on. I love hearing it.
Our pleasure. Thank you.
All right, guys. Well, thank you so much for joining me. Andrea, Jeff, again, the folks from LexisNexis Risk Solutions, specifically the healthcare vertical. Check them out. And to find more interviews with the who's who of health tech as they are changing the way that we do healthcare, head on over to my YouTube channel. It's youtube.com/WTF Health. I'm Jessica DeMassa. Thanks so much for joining us. We'll talk to you guys soon. Take care.